Thank you for joining us for this briefing on COVID-19 and our local response. Joining me again is Francis Beaurivage. Thank you, Francis, for your interpretation services. And thank you to the media and all of our community members who are tuning in to learn more about how you can protect yourself, your loved ones, and your neighbors during this pandemic. We want to remind everyone to please visit our website, covid19.lincoln.ne.gov, where you can continue to access additional updates and resources to help navigate these difficult times. The website includes a data dashboard that is updated every day about the time of this briefing, and that dashboard has more detailed demographic information from our case investigations. On the website, you will also find the COVID-19 risk dial. This is a visual color-coded depiction of local conditions we are experiencing here in Lincoln and Lancaster County. In essence, a forecast of the risk of COVID-19 spread. Along with the forecast of local risk, the dial offers guidance for individuals and businesses about what actions and behaviors we can take to protect the health of ourselves and everyone else in our community. And even though a number of the key public health criteria have been trending in the right direction here in Lincoln and Lancaster County, we want to be clear that the risk of COVID-19 spread in our community continues to be high. With the easing of some directed health measures beginning June 1st, we will all need to be prepared for a potential uptick in COVID-19 infections. And we will all need to play a role in preventing any uptick in infections from becoming a surge. From the city's perspective, being prepared to stop any uptick from becoming a surge looks like our local health officials continuing to, one, advocate for faster testing result turnaround times from private labs, and two, build capacity to do any necessary contact tracing in a timely manner. Being prepared to stop any uptick from becoming a surge from the community's perspective looks like each of us faithfully washing our hands, wearing face masks around other people who are outside our household, and keeping 6 feet of physical distance from others. June 1st is not some magical date when all of a sudden we are out of the woods. On the contrary, this is when the difficult, longer-term work of the dance of coexisting with and containing this virus until there is a vaccine truly begins. We cannot emphasize enough how important it is that everyone frequently washes their hands with soap and water, keeps a 6 feet distance from others outside their household, and wears masks and stay home if you are sick. These are proven strategies that can save the lives of our loved ones, our friends, and our neighbors. We unfortunately begin the situation update portion of this briefing with news of another individual who has died from COVID-19 here in our community. This is the 9th death of a Lincoln community member, and our hearts go out to all of those who are feeling the pain and sorrow of this loss. And over the 3-day weekend, we had 85 of our community members receive lab-confirmed diagnoses of COVID-19. Today in Lincoln, we have had an additional 7 individuals test positive for COVID-19. The total number of lab-confirmed cases in Lincoln now stands at 1,097. Our total recoveries identified to date remain at 134 individuals. And again, the recoveries number may be unchanged on some days because an individual is not deemed to have recovered from the virus until 28 days after they tested positive for COVID-19 and have been confirmed to be symptom-free. Here to share additional important public health messages and more on the latest case investigations is Health Director Pat Lopez.
Thank you, Mayor. As the Mayor mentioned, we are reporting another death in our community today, and this was a male in his 90s that had underlying health conditions and had been hospitalized. On to some of the other key indicators we look at is the amount of testing we are able to do in the community, and that has continued to increase. This past week, from Sunday the 17th to Saturday the 23rd, nearly 3,500 tests were completed. Bryan Health and CHI St. Elizabeth reduced the testing hours on Sunday and Monday, but they were still able to complete 585 tests at the hospitals and through their drive-through testing sites from Friday through Monday. Test Nebraska did not operate on Sunday or Monday, but resumed today and will continue at the Lancaster Event Center here in Lincoln for the remainder of the week. They will move to a new location June 1st and return to Lincoln again later in the latter part of June. Again, anyone who has symptoms can be tested. The process starts with an online risk assessment at chihealth.com, bryanhealth.com, or testnebraska.com. If you have difficulty accessing a test, please feel free to call our health department at 402-441-8006, and one of our nurses will assist you with questions you have. Another indicator that has shown improvement is the overall positivity rate. It has dropped from a high of 9.8% on May 11th down to 7.9% today. The overall rate for the state is now down from 15.2% last week to 14% today. The overall national rate is also down from 15.7% last week to 14.3%. Our hospital capacity has also remained relatively unchanged. The number of COVID-19 patients in our hospitals has decreased from 42 on Friday to 36 today. 23 are Lancaster County residents and 13 are from outside the county. The number of patients on ventilators is also down slightly from 12 on Friday to 11 today, and 7 of those are individuals from Lancaster County and 4 are from outside the county. Lincoln hospitals and surgery centers continue to expand and complete more elective surgeries. However, this has been done gradually, and there has been little impact on hospital capacity or IC bed use, and the supplies of PPE remain good. The number of Lancaster County residents who tested positive that are connected to the outbreak at the Smithfield Creek plant has increased from 292 on Friday to 308 today. 177 are employees at the plant, and 131 are family members or other direct contacts. As the contact tracers work with our epidemiology team to investigate new cases, they have identified other small clusters. The number of positive cases connected to the Smithfield plant in Lincoln has increased from 20 last week to 25 today. That's 17 employees and 8 direct contacts. The number of positive cases connected to Smart Chicken in Waverly has also increased from 15 last week to 25 today, with 16 employees and 9 direct contacts. Again, we continue to be at high risk for the spread of COVID-19 here in Lincoln. We should all assume that we are at risk of contracting the virus anytime we are around others. Remember, any of us could be an asymptomatic carrier. When you wear a face covering, you are sending a message to others that you care about their health and safety. The virus can spread very quickly, and your actions at this time can impact our entire community.
Thank you, Director Lopez. Today, we turn to the topic of housing and economic security for our residents. This topic is one we focus on every day here at City Hall, as the COVID-19 pandemic has taken an unprecedented toll on the financial health of our community. Many residents are facing critical financial challenges, some for the very first time in their lives, and they're relying on support from generous community members and nonprofit organizations to meet their basic needs. For those in need of assistance, Lincoln is fortunate to have a rich network of nonprofit agencies that can provide support and resources. Here to share information about some of these resources is Michelle Martinez, Director of Community Services for the Community Action Partnership of Lancaster and Saunders County. Community Action provides programs that address the causes and conditions of poverty and empower people to reach economic stability. And with that, I hand it over to you, Michelle. Thanks for joining us today via Zoom.
Thank you so very much, Mayor, for giving us the opportunity to speak today. Community Action Partnership of Lancaster and Saunders Counties operates 18 distinct poverty fighting programs within 4 impact areas, which are early childhood education, homelessness prevention, financial and family well-being, and hunger relief and healthy food access. Today, I'd like to focus on two of those programs within our homeless prevention services. The first program is our emergency services program. Emergency services provides rent use assistance for households with an eviction notice, utility assistance for households with a disconnect notice, and deposit assistance for households transitioning out of homelessness. If you find yourself receiving an eviction notice, we would encourage you to reach out to us. You can apply for assistance over the phone by calling 402-471-4515. The second program today is our tenant support services. Our tenant support services program focuses on eviction prevention, landlord and tenant mediation, and information regarding tenant rights and obligations in the state of Nebraska. If you have questions, please call our tenant support specialist at 402-875-9353. We'd also like to invite you to visit our website at www.communityactionatwork.org. The tenant support page has information regarding landlord-tenant law, as well as sample forms and notices. Thank you.
Well, thank you so much all for the incredible work that you do and that all of your colleagues at Community Action do every day to support our residents in need. Community Action is one of a number of nonprofits in Lincoln that provides assistance to residents facing financial hardship. Catholic Social Services also provides immediate cash assistance through their emergency services program to those struggling to pay their rent or utilities. They take requests for assistance every Monday morning beginning at 9 a.m. and make appointments for the first 10 eligible callers. The number to call for Catholic Social Services Emergency Services Program is 402-327-6211. And as always, information about these resources and others is available at our website, covid19.lincoln.ne.gov, under the Resident Resources tab. With June 1st approaching next week, we know that many residents who have lost work due to COVID-19 will be facing the question of how they can afford to pay their monthly rent and utilities. At this time, more than ever before, the health of our residents depends on access to safe and stable housing to minimize the spread of COVID-19. The executive order issued by Governor Ricketts in March, which deferred eviction trials based on non-payment of rent due to COVID-19, that order will expire on May 31st. The Federal CARES Act, signed by the President in March, still provides eviction relief for tenants in federally backed housing through July 25th. However, nonprofit agencies in Lancaster County anticipate an increase in evictions in the coming month, coinciding with the expiration of the governor's order. From City Hall here in Lincoln, we want to thank those rental property owners and residents who have worked together and developed plans to navigate this difficult time. We once again encourage renters to continue to communicate with their landlords about their situations. And we once again ask rental property owners to continue to work with your tenants to create reasonable payment plans to ease the immediate burden on folks who may still be waiting to receive their unemployment checks and stimulus payments. It's incumbent on each of us to do what we can to ease everyone's burden during this difficult time and to stop the spread of the virus by keeping people safely housed during this pandemic. For those facing eviction, resources and legal assistance may be available to help. Legal Aid of Nebraska has created a hotline to assist those with legal questions related to COVID-19, and the number for that hotline is 1-844-268-5627. Again, that number is 1-844-268-5627. You can also apply for assistance online at lawhelpne.org. Now, even though Governor Ricketts' executive order provided a legal defense against eviction to renters with a loss of income related to COVID-19, dozens of residents have still been evicted since the beginning of the pandemic. Unlike criminal defendants who have a right to a defense attorney, tenants facing a civil action like eviction do not have an automatic right to an attorney and are often unrepresented when presenting their case in court. This imbalance in representation is not uncommon, as studies show that an estimated 90% of landlords have lawyers, while only about 10% of tenants do. A right to an attorney is a right to a fighting chance, as tenants with full legal representation are twice as likely to stay in their homes, get twice as much time to move, and are 4 times less likely to have to resort to homeless shelters. To help those residents in eviction court, volunteer attorneys like Mindy Rush Chipman, Ryan Sullivan, and students at the UNL Law Civil Clinic have worked tirelessly to provide free legal representation at the Lancaster County Courthouse. Thank you, Mindy and Ryan, for your incredible work to ensure that as many residents as possible receive representation when at risk of losing their housing. And with the number of residents facing eviction next month expected to increase substantially, there is a greater need than ever before for volunteer attorneys. That is why today I am pleased to announce a new program called the Tenant Assistance Project to help tenants facing eviction secure access to free legal representation. This program, developed by the UNL Law Civil Clinic, the Volunteer Lawyers Project, Legal Aid of Nebraska, the Lincoln Commission on Human Rights, and Nebraska Appleseed, will train and provide support to volunteer attorneys to represent tenants with eviction cases in the Lancaster County Court in a limited scope capacity. All attorneys volunteering through the project will be covered by the Volunteer Lawyer Project's malpractice insurance and will receive training on appropriate legal defenses to raise on behalf of a tenant, as well as be given an opportunity to shadow an attorney who regularly litigates these sorts of cases. If you're an attorney and you're worried about potential conflicts in representing a tenant, we would note that the ethical rules surrounding conflicts of interest are relaxed in cases where you are providing only a limited scope representation, as would be the situation here. If you are interested in learning more about volunteering for the Tenant Assistance Project, please contact the Volunteer Lawyers Project today by emailing nevlp@nevlp.org or call 531-220-6773. Again, that number is 531-220-6773. With your help, we can ensure that everyone at risk of eviction has access to legal representation. This access to legal representation is essential to helping tenants preserve their housing, make rental payments on an appropriate schedule, avoid the potential for homelessness, and assist in protecting everyone's health by keeping people safely housed during this pandemic. And we recognize that these are difficult times for everyone, but we would urge any attorney in Lincoln who has the capacity to volunteer to reach out to the Tenant Assistance Project and provide limited scope representation to tenants. And by volunteering for this project, you will be serving not only those with limited means, but you will also be serving the community as a whole by helping to keep people housed and safe during this public health emergency. And with that, we'll add some final bits of good news. As we all long for greater interaction with others during the pandemic, local book clubs have continued to meet virtually. And the city's biggest book club, our One Book, One Lincoln community reading program, has announced the 3 finalists for this year, 2 novels and 1 nonfiction book. This is the 19th year for this program, and all of us are invited to read the books and vote for one of our favorites. You can vote at lincolnlibraries.org and at the library's Facebook page. The books are available in all formats. Our libraries remain closed at this time, but you can still reserve your copies and find out more information about the program on the library's website. And again, that's lincolnlibraries.org. We have some great news from our wonderful children's zoo. The leaders there have been working with our health department team on a modified operational plan that will allow the zoo to reopen June 1st in a safe way. On Monday, the zoo will start its wildlife walk, a one-way path through the zoo. They will allow 30 guests to enter every 15 minutes, and you will find staff in PPE and, of course, lots of hand sanitizer, and some areas will be inaccessible for now. And I want to thank John Chapo and Evan Colleen and all those at the zoo who have worked so hard to reopen one of Lincoln's favorite places in a way that keeps visitors and staff safe. You can find out more at lincolnzoo.org. Finally, we've been sharing art from children every Monday as part of the Sunshine Kids for Seniors project. We call it a Sunshine Monday. We did not have a briefing yesterday because of our observance of Memorial Day, but we did decide that everyone needed some sunshine on this gray sky day, and so we are bringing you a Sunshine Tuesday. Aging Partners is helping connect children with our homebound seniors by sending notes and artwork. If your family would like to participate, please do. You can send your scanned notes and artwork with first names only on them, please, to sunshinekids@lincoln.ne.gov. And with that, we'd be happy to open up for questions from the media.
Riley Johnson with the Journal-Star with a question for Director Lopez.
All right, she'll be right here.
Good afternoon, Riley.
Good afternoon, Pat. With the latest death today, and then I think the one from over the weekend, is there any change to the number of deaths that were among folks that were residents of long-term care facilities? I think the number was previously 3.
You know, Riley, I don't have that information right in front of me. I believe one was, but I need to check on the other one.
Sure.
One was.
Another unrelated question. A lot of times when you talk about hospital capacity being good, is that the overall number of beds, or are you talking in terms of the staffed beds, as some hospitals have the potential to have a lot more beds, but they all don't necessarily have the staffing immediately on hand?
When we talk about the overall here in Lincoln, we're talking about staffed beds. So that's one of the things we did early on in developing how we would address surge should that occur. So we look at what our staffed beds are.
And when you assess the health of that, have we gotten close to 100%, or have we gotten above 90% of staffed bed capacity?
No. We've remained far below that right now, Riley, and I can prepare some numbers for you tomorrow just to give you an idea where we're at with our percentages and our staff numbers. We look at that every day.
Great. Thank you.
Mm-hmm.
Hi, Pat. This is Bill with 1011.
Hi, Bill.
I'm just curious on the recovery totals. I've noticed they haven't changed in, I believe, 5 or 6 days. I know you said one of the key metrics was 28 days symptom-free. If we go back in our 28-day calendar, it seems, from 28 to 33 days, there was 60, 70 new cases in Lincoln back in late April between that time frame. So one would suspect there would be dozens of new recoveries over the last 5 or 6 days. Can you elaborate on why the dashboard doesn't reflect that?
I think as we had an influx of some cases, and so we were working on contact tracing, and then over the long weekend, we really didn't have staff doing recovery tracing on Saturday, Sunday, or Monday, just to try and give them a little break. So you can look forward to seeing an increase in that number, Bill, coming up. And remember, even though we say 28 days as guidance, some people have symptoms longer, so we don't count them as recovered, but you will be seeing a change.
Okay, thank you.
Uh-huh.
Pat, but you place a priority on contact tracing new cases over recovery tracing?
Yes, we do place, because our most important thing is with the contact tracing, those would be individuals who have a positive test. So we want to give them information about how they can care for themselves. And then we also want to mitigate the spread and let people know who've been in contact with the individual as well, so that they can quarantine.
Talking about contact tracing, the 3 facilities you mentioned, each with 25 plus cases tied to it. Are there any other clusters in the 10 plus range, or is there a certain threshold places have to hit before you would identify them?
You know, it depends on the facility and what their capacity is and the number of exposures in the facility. We've had some other really small, like outbreak situations, I think I've mentioned before. We call them an outbreak, but they're clusters, maybe related to just one area or one business.
Nothing new that's significant, though.
No, there haven't been any. We just continue to watch several areas and see how they're growing. Kind of related a lot to meat processing areas, places where people work in really close physical contact with each other. But we've had some smaller little outbreaks, not really cluster events.
That was all I had. Thank you.
Uh-huh.
Any further questions from the media? All right, well, thank you so much for tuning in to learn more about how you can protect yourself, your loved ones, and your neighbors and our community. We'll be back again tomorrow at 3:30. Stay well.